Periscope up. We are up.
Periscope.
I'm going to hand it to you.
All right.
Go ahead and say hi to people as they come in, and we'll start a show here. No, you need to turn it over. Okay. Now,
Am I there?
Well, now it's going to be on you. I'm sorry. So you can see yourself. There. I mean, so you can see the comments, and you can put it on me.
All right.
We're going to start the show. Here we go.
All right.
3,
We got a couple joined here.
2,
7 joined.
1.
And the show is on. Hey, they were getting happy 4th of July here.
No, the show's not on. I didn't start.
Okay, Periscopers, welcome. We're doing Ask the Doctor, but we got to get
the live show going, so I got to start
our live show going, our podcast.
All right.
You guys are going to be the star of the show because you'll ask
the questions.
And this will be out in podcast form later. So
here we go.
If you fully understand where we're going, we're playing our intro music, I think.
No, right now.
Okay, Smithy 92 UK.
Welcome to Medically Speaking, Auburn's own medical radio show with host Dr. Mark Vaughan of the Auburn Medical Group and Larry Finney.
He says you're your favorite doctor.
Yes, here we are, the very kind people. And this is Medically Speaking Radio going out live over medicallyspeakingradio.com, where you can hear it using the wonderful app called Mixler that's actually already on our website. You don't have to install it. But we're also available on Periscope. People can write in their questions there. And I think Larry will be our moderator of the questions.
I'm going to moderate the questions. I'm hoping to get a lot of comments, so I'll be asking the doctor, or you'll be asking through me.
Yes.
All right, let's do that.
And unlike most Periscope users...
Hey, Holly.
Oh, you're saying...
He just says hi.
He's greeting all of the people as they come in here. We have our regulars, Holly and Danielle. I'm sure Danielle is there also, because Holly and Danielle...
Mike Sheehan has joined us.
Excellent.
Princess Mitch is inviting followers. Yeah, okay.
We were going to have a show with... let's just say it was going to be about men's health. That's as specific as I'll be. We'll get after him later.
Ray too. Ray's in here.
Ray's here too. We're instead going to talk about questions that our listeners bring either through Skype, through medicallyspeakingradio.com, or through Periscope. And we are also available to speak about recent events in the news. I put up a post this week on auburnmedicalgroup.com regarding the law in California about vaccination, where I disagree with what most doctors feel about it. Let's see, I can't take this out because I have to be able to hear Skype. Or can you hear it? Yeah, you'll hear it if it comes.
Yeah.
What else have we talked about lately?
Well, we could talk about anything our Periscopers want to talk about. Well,
okay.
And while we're waiting, we would like to know. Oh, wait. I am in California, doctor, for vacation, says someone.
Oh, excellent. Great place to have vacation.
Hopefully she's enjoying the weather and it's
not absolutely
hot. Maybe you can find some actual water somewhere.
Yes. There is on the coast.
Yeah.
Not so much around here.
This turns out that this is our 100th.
100th Medically Speaking Radio. At least the way we posted them on iTunes. This is the 100th episode. Yay, let's celebrate. This is how we're celebrating.
And we're getting congratulations from some of our followers.
Yes, thank you. We appreciate that.
Hello from the UK. Wow.
The UK, thank you for joining us. You also are welcome. I'm not sure how easy it would be to Skype in, but it's Medically Speaking Radio is the Skype address you would use if you wanted to Skype to us. And with your question, we'd actually have your voice on the air. Not really on the air, it's on the Wi-Fi. Well, I guess it is on the air if they use Wi-Fi.
Yeah. So all you Skype followers, drop us a question or two.
Absolutely.
You have access. Free medical access right now. Of course, if we had lawyers here, they'd say, well...
I was going to say, and I do this quite often throughout the week, and what I find is that people tend to slip into asking personal questions. Go ahead.
Asking if we're taking questions. Yes, we are taking questions.
Yeah, it's not so much... I'm not being somebody's doctor here, but we're just talking about medical topics. So usually the questions are phrased as, I have a friend...
Okay, well, here's our first one. Someone asks, Holly asks, what are the top supplements or herbs to take for inflammation? In other words, I think she wants to avoid the NSAIDs. Or,
the NSAIDs?
Yeah.
Well, actually, the natural product that provides anti-inflammatory benefit is the same thing as an anti-inflammatory drug. It is acetylsalicylic acid, which is in willow bark.
Aspirin.
Yeah.
AKA aspirin.
Yeah, so if you want to get an effective dose and know how much you're getting, buy an aspirin.
So that actually comes from willow bark, huh?
Yeah, if you're out in by the pond and there's a willow and you start chewing it.
Is that why we used to see the whole thing about people chewing a willow branch? Here's a good one.
Yes.
In fact, I would like to know this one myself.
Okay, we'll do this.
I would actually like to know this one myself. The best way to remove skin tags.
Oh, okay. We can talk about it a little bit here. I like two methods for different reasons. I like just freezing the base of them with liquid nitrogen, actually spraying the liquid onto the base of it because it's small, right? And if you can kill that off with just causing frostbite, it'll fall off. And so we'll spray liquid nitrogen on it, keep it white for a good 10 to 20 seconds, let it thaw out, and then do it again right away.
Could you tie a thread or a piece of like dental floss around
Ligation is another technique that could be used, although I never use it. I leave that to the farmers and ranchers. Another method is just numbing it up and transecting it at the base, just with a razor going across. Now, home techniques, most people don't have anesthetic. Most people don't have sterile instruments, so we don't officially recommend it. We recommend against using rusty toenail clippers, which some people use. And then come in for the tetanus shot.
Someone's asked, what's the best way to boost immunity in the body?
Actually, interesting. Unless you have some kind of immune deficiency that needs to be worked up and addressed, for average Joe who wants to have better immunity, it's getting good sleep and good nutrition and regular exercise. As far as any kind of supplement, there's some evidence that maybe some protection from vitamin C and zinc, particularly for upper respiratory infections. These are ingredients you often see in the, what are they called? One's called Airborne, the other one's called, I hate to pick on just one. Actually, one of those got in trouble with a court ruling. They could not any longer make the claims they were. Those things don't do anything when checked for real studies against a placebo. They don't do anything once you have symptoms of an upper respiratory infection. Nothing more than a placebo. But go ahead and keep up the vitamin C and the zinc.
Yeah, I got another question. Someone asked about are bone spurs on the lower back anything to be concerned about?
No. See, this is something we talk about quite often on Ask Dr. Vaughan. Testing, unnecessary testing, or testing for things that when there's not a problem. You will find things. You will find bone spurs. You will find liver nodules. You'll find lung nodules. Unless we have a reason to go looking for it, we try not to find them.
So I suspect this person, though, has asked because they have them. So I guess the follow-up question would be, are you experiencing symptoms?
I was going to say, why were we looking for it? And oftentimes what we'll find is the bone spurs, just arthritis. Almost everybody gets them with age. May be completely unrelated to the area of symptoms.
Oh, here's one. I'm intensely interested in this one. This person asked, are there natural ways? She says, following up to the bone spurs. That's what happened. They x-rayed for muscle spasms and found scoliosis. So
okay. Which there may be some connection there, but we're not necessarily going to fix it.
So this person asked, what's the best way to boost libido in women over the age of 40? I'm thinking it's the best way to boost libido for women over 40. It's
a husband under 20.
Yeah, husband under 20, or diamonds for everyone.
Oftentimes people will ask about using androgens, male hormones, because they increase libido. And in fact, I do see that some doctors are doing that and some not doctors are doing that. It's amazing how much medicine gets practiced without a license. But here's the problem with using androgens to promote libido in women. The baldness and the acne that they cause really don't help the situation. I'll just leave it at that.
In other words, you see this? You catching this?
Lots of androgens.
So now the wife, or we're looking like
you're almost in the frame.
I know, almost. Am I not in the frame? All right. I'll get this.
Have it straight on with yourself.
I'm going for the full Howie Mandel. All right, Howie Mandel, yes or no? Right?
You're like right in the. Oh wait, somebody's writing. I had a CAT scan and there was a mass found. My doctor told me not to worry. Most people do. It's tough. You use the generic term mass there. I don't know any more details than that word, so I can't comment at all on what that was found.
Wow, Telly Savalas. That's old school.
Oh, my goodness.
Somebody
We
old
have
enough
people
to
old
remember
enough to know
Telly,
who
huh?
Telly Savalas is? Wow. We respect you, audience.
Right.
You're on Periscope and you know who Telly Savalas is?
Yeah. Oh, okay. Well, somebody asked if that The Rock. Well, I wish. Right?
Oh, nice.
Dwayne Johnson himself.
Right here in the studio.
Okay. So
With
where were we?
with a wife over 40.
With a wife over 40, and looking to boost the libido. So we got into that, but the questions are coming much more quickly than we can handle them.
That's what you do. You just kind of pick one you really like and you go with it. And I don't mean to be mean to our participants, but truly you kind of ignore them just so you can focus on one that really is good. Not that they're not all good. It's just that's the nature of Periscope. You have to pick one.
Yeah. Someone wants to talk about the nature of marijuana and lowering blood pressure, and I think they'd asked earlier.
Blood pressure or eye pressure?
No,
Intraocular
they said blood pressure.
Okay. I know as far as lowering a pressure, usually you'll see it in the setting of glaucoma or too much pressure inside of the eye. Blood pressure, anything that allows a person to relax will do that. Marijuana is not an effective antihypertensive, though. I mean, some people will get lower blood pressure when they're stoned. That's about the extent of it. You can do that with alcohol, too, by the way. But, of course, with alcohol, then you have the higher blood pressure when you're not stoned. So that's counterproductive.
Someone's taking an anatomy test, and they're trying to get some...
they're periscoping while taking a test.
Yeah, they're trying to help the doc. The doc's trying to say, what is the following microscopic structure? Which is the following microscopic structure found only in cardiac muscle tissue?
Cardiac muscle?
I'm not
Striated
sure.
muscle that branches?
Feel like do you have what? Okay. There's some of the questions I can't quite make out.
I know.
They're missing.
And actually there is histologically, there is something uniquely in cardiac tissue. I think it's the branching striated muscle. That's the only place you see that, but there may have been something else I don't remember from, 22 years ago when I took anatomy and histology. Histology being the study of you take the organ, and then you section it into microscopic sections, and you see what kind of cells are in it. That's histology, all the cells together. And then cytology is just individual cells, the makeup of them.
I think she's asking what is somato, SOMATTO, as in what's somato with you, man?
What's the matter with you?
What's the matter with you?
Are they Italian?
I don't know.
I don't know.
Somato.
What's the matter with
It's a red fruit that we eat with pizzas.
And sriracha.
And sriracha sauce.
Yes.
Absolutely. Someone was asking about allergies.
Yeah.
And I've long forgotten the question, but I think they were trying to, is there a way to reduce allergies without surgical interventions? He said their sinuses are really... sinuses. We always try non-surgical approaches first. Surgical approaches for allergies often the surgery has to be repeated a few years down the line because what they operated on actually grows back. And so some people will do dramatic surgery. Other ways to deal with allergies. I'm not an allergist myself, but... Okay, she said the medications are not clearing the sinuses. So then where do you go?
Yeah. If it's that case, before you go to an ear, nose, and throat doctor who does the sinus surgery, you would first want to be sure you've already seen the allergist, which you may have already done that, and they go over all the different non-surgical treatments
go
before
to Home Depot and rent a pressure washer.
Or what was the guy that did the drill? He was trying to clear out his nasal passages.
Sick. Yeah. Some people are just not right.
Yeah.
Unbelievable. Well, let's see. What else? What other questions you folks have?
I can talk about allergies until you get one. Allergies, treatment. The first line treatment is, if we're talking about the runny nose, itchy eyes type allergies, maybe a little bit of asthma type symptoms, but we try to separate that from just general allergies. Just using the steroid nasal sprays that are now over the counter, the Flonase and Nasacort. Step 2 would be either replacing that with or adding to that Claritin or Zyrtec. And if that's not working, move up to the Allegra because it's more expensive. And a lot of people respond to the cheaper stuff. And then there's other medicines that can be added to that, or allergy, actual immunotherapy, where they give you shots every week for a couple months, I believe it is. And that's done through an allergist, and they'll do testing for that.
There's somebody just threw out that they use Zyrtec for postnasal drip.
Yeah, Zyrtec works for many people. I'm not as much a fan of the Zyrtec as the Claritin because it can be more sedating. Even though it's kind of marketed the same as Claritin, it actually is more sedating. And I think they say it's supposed to cover more types of allergies. In real practice, the Claritin works as well. And it may even cost less, with less side effect.
Well, we have at least one smoker out there who wants to...
Wants to quit?
No, smoker of weed. Says that smoking high concentrations gives you a feeling of being dehydrated.
Yeah. That's my entire discussion on that.
And it makes you want to eat Oreos, too.
Eat anything. Sriracha on pizza.
That's probably why you're feeling dehydrated. You're eating all the dang potato chips.
It's the munchies. It's not
the munchies with all the salty crap. And
it's not the weed. It's the munchies. Are they salting their weed before they smoke it? And why are these people smoking? I keep telling them if you're going to be a pothead, eat it.
Yeah. So if somebody's asking how long is this broadcast?
Well, at this point,
we start off with and then we fizzle out altogether.
It's kind of like when you're setting off fireworks and you see the fuse going, and then it spits out a little bit less, and it spits out a little less, and then it's getting down to the very end, and you're not sure if it's really going to blow up or not.
Okay, well, there's the old weight loss question. Any supplements or natural ways to lose weight besides diet and working out? I mean, doesn't everybody love to do the besides diet and working out? You know, is there a magic pill that can be taken?
There are lots of products that you can find on late night television and afternoon television, right? and you can get
methamphetamine works pretty.
You
good,
can go to a diet doctor and get methamphetamines. These are things that can be done. They're actually for natural. I'm having a hard time coming up with a natural one other than the diet and exercise.
But is there an herb that...
The herb, huh? Yeah.
Smoking marijuana wouldn't because it
no. The herb.
That's an herb that we don't want to...
It works against the purpose there. No. Not that I know of. At least not that's going to take you from whatever weight you are to what you want to be. It's... diet and exercise. Now, our guest last week, Dr. Flock, he speaks a lot, because he's a bariatric surgeon, he speaks a lot about things that make it harder for people to do it through diet and exercise, and then they end up going to him because they're just not getting the job done.
In other words, some people's metabolism or their weight set point or whatever is just...
that's part of it.
That way.
And it is harder in that situation, but it's still done the same way. And then he's also talking about the gut flora, the bacteria that live inside of you, can influence how your body handles food and makes it not as efficient or more efficient. Actually, more efficient. So you end up getting more out of what you eat, which is not what you want when you're having a problem with weight.
Okay.
And there's research being done on that to try to help get rid of the inflammation in the lining of the gut so that there won't be as much of an issue.
Yeah, someone comments that it seems to be a philosophy that I will do anything except diet and exercise.
Yeah. And I understand what Dr. Flock had said, and even somebody made a comment on my blog posts or on the video series that I did on weight loss about perpetuating this idea that there's something wrong with the person not dieting enough or not exercising enough, because there's other factors out there. And I don't want to say that there aren't other factors out there. And if people are dieting and exercising and they're not getting the response they need, I do want them to see a doctor for a workup, because there are medical problems that can be addressed. Hypothyroidism just being one I can think of off the top of my head. Things that do need to be addressed.
There's a kind of a fascinating hypothetical question here. Someone asked, are most doctors physically healthy? And you would think they would be. I think it depends on, I think it's a generational thing. I think my generation, for the most part, the doctors look healthy to look at them. The previous generation, going back a ways, I can actually have a picture in my mind of a fat doctor smoking a cigarette. Really?
You know of one, or can you think of one from when you were a kid growing up?
I tried to avoid the doctor as a kid. Avoid the smiling doctor who has one hand behind his back.
No, that's the nurse.
Okay, whatever. They've got a hypodermic needle, right?
Is that what inspired the writing of Big Shot?
Yeah.
The video. Some of our audience has seen that, the video Big Shot. Where it's on the Auburn Medical Group YouTube channel, starring Larry Finney.
Was I in there? Yeah.
That's all right.
Yeah, there's someone that mentions, and it's my doctor as a kid smoked around the kids a lot. So.
That's the way it was back then. In the 50s. Whoa, that would be you.
Yeah, it's my phone blowing up here.
Your phone blowing
apologize.
up. That's okay. This show could end at any moment if we get
absolutely abruptly
home health nurse call or a patient call. The show's over. That's it. The end of show. It happens sometimes.
Someone says say and cough. I think it's turn your head and cough, isn't it? No, we're not going to start doing procedures for Twitter.
I'd like to talk about that if we could. If there's no other comments,
doing actual procedures on Periscope.
The procedures, you can find them at AskDrVaughan.com. If you forget that, and all you can find are the little web addresses on my Periscope description, both of them have a link in the menu to Ask Dr. Vaughan, and that's where we keep all the archived videos of the procedures we've done on Periscope. And this week we did the hematoma drainage, where you had all the thick blackberry jelly looking blood coming out of the patient's knee.
Ew.
Yeah. Yeah.
So what happened to this individual's knee? It was a sports injury or?
No, it was just, it bumped it against the cement, a step or something like that. And they had a hematoma form under the skin, and it just never went away. It kept hurting. And the reason we were concerned was because there was a skin infection over it that we had to treat. And then we kept thinking, because there was this what we call fluctuant or squishy mass, that, maybe there's an abscess that hasn't fully gone away, and that's why we had to cut into it. And it turns out it was just a hematoma. So while we were already in it, we went ahead and drained it, got it all out. You're smiling over there. What is
It's a question I can't really pass on.
Oh, okay.
Because, sir, your question would be archived forever in the world of podcastdom.
Is it one of those people who needs to be blocked?
No,
they do come up.
Be blocked.
No.
I think it's funny, but
Larry thinks it's funny, so. But it's not an entertaining Larry time.
There's someone who says, this is back to the weight thing, that they're never hungry when they're weighing 77 kilograms or more.
Okay.
But at lower weights, when they weigh less, they tend to be hungry all the time.
Okay, that sounds desirable.
77 kilograms?
Well, it depends on the person.
Yeah.
I mean, how tall they are.
Let's translate that. 2.2 pounds per, I don't know, what is that, 140? And I don't know, male, female, how tall? Whatever.
Right.
Yeah.
Well, we don't know the details. So I'm glad that limits them from getting more than 77 kilograms, whatever size or whatever height they are.
Someone asked, what's your favorite thing about being a doctor?
Oh, you can see it. You can actually see my favorite thing about being a doctor. It's one of the cortisone shots, one of the shoulder cortisone shots, and I don't know which one, but it's the one that at the end, it looks like the lady is almost crying because she can move her shoulder again. And what's so cool about that is we go from having her all set and doing the shot, we do the cortisone shot, take it out, she moves her shoulder. It's that quick that it's numbed up, and she's able to do what she couldn't do before. That's cool.
When you get them to,
yeah,
it's a miracle.
Yeah.
Someone says that on the Periscope that the web address is actually cut off.
Oh, is it?
Yeah, so that you
we'll work
can't
on that.
see it on Periscope. So we'll have to work on
there should be a couple of them. One would be auburnmedicalgroup.com, and the other one would be medicallyspeakingradio.com.
So, in other words, if they just want to go straight to those websites,
they would find Ask the Doctor, or Ask Dr. Vaughan, AskDrVaughan.com. So you can use either one of those to get to it, or you can put in directly Ask Dr. Vaughan. But the reason I don't tell people go directly to it is because then they have to spell Vaughan correctly.
Well, so this one person asked if it's like texting and driving. If you're periscoping and performing a procedure, I mean, is that just...
Oh, no. You want somebody else to be holding it. It's like teaching residents or medical students, because I'm talking to the audience and describing to them what I'm doing. But to a certain extent, it does take away from being one-on-one with the patient to have that other party there to do the teaching. And that's the case in any teaching institution, any teaching hospital.
Yeah, but you're not actually operating the camera.
I did on one.
Oh, did you?
Yeah, I did.
Put a GoPro on your head.
I'm trying to remember what the procedure was, though, because usually sometimes I'll have the patient hold the phone.
It's a Operation Selfie.
I'm trying to remember what we did that on. I think it was a knee injection that we did that.
And the patient held it?
Yeah, the patient held it. It worked out fine.
They didn't
totally
scream
fine.
in pain and drop the phone?
No, I think they may have had one done before.
Someone mentions, though, vis-a-vis the
shoulder?
cortisone, that those shots don't last. Well, and yeah, that's true.
Oh, well, hold on. That's the medicine does not last, and the effect of it is variable. If we got the inflammation down and the problem is resolved, then we're good until something comes along that aggravates it again and recreates the inflammation. Or they may have an anatomic problem of there's a very small passage for the tendon to go through, so it's vulnerable to having that happen again. And the only thing that's going to fix that is an operation. And then you have the people who just don't get complete inflammation resolved, and that'll come back within days, weeks, or months. But that's the exception.
Okay, so it's all about the inflammation. It's not just masking pain so that you can move through it.
Well, there's that part of it too. That's why the patient was able to move her arm immediately after the procedure. It was because of the anesthetic. Well, that wore off in about 5 hours. And then you have to wait possibly a couple days for the cortisone to kick in. But once it does, if that inflammation goes down and they don't aggravate it again, we're good.
Okay, so is there anything to extra hand vasculature as a cause for fibromyalgia? In other words, she's saying got more veins in your hands than...
I don't know of any connection there.
Yeah.
No. There's a lot of people with very veiny bodies that don't necessarily have fibromyalgia. And you can see that there's more prominent veins in the skin in different situations. One of them being bodybuilding. You'll see those bodybuilders with the ridiculous, monstrous veins. And it's just because there's so much blood having to be delivered and taken away that you see those veins very prominently.
Well, we had one of our listeners take a little vacation. She's back now. I'm a CNA and noticed one of my residents talks to people who aren't there. Is that normal?
Oh, gee. You can see that sometimes. It could be a side effect of medicines they're on. It could be symptoms of actual neurodegenerative disease that can happen with some of the dementias. It can also happen with people who are just plain mentally ill and have delusions. You see it a lot in the evening when the ambient light is going down and their eyes play tricks on them. We actually have a couple of comments. One of them is, I can hardly hear Larry, and Larry is much quieter than Mark. That would be because you're not on the mic.
This is like operating the camera and the thing. So I'm trying to find the comfortable position where I can get right up. Maybe you can turn up my gain a little bit.
Okay.
There he is. How's that?
Makes me nervous doing that.
I know. Might lose me altogether.
You never know when you'll go too far.
We don't want to go too far.
Ooh.
Okay.
Wow.
No, we're hearing...
No, we don't want to blow out people's ears.
All right. We're good. So where were we? She says this person has like full-blown conversations with people who aren't there.
Yeah, it's amazing. And, as long as it's not turning into agitation, there's not any urgent push to make it go away. You'd like for them to be in touch with reality.
Yeah.
And so that could be looked into, looking at the medication list to see what may be causing or contributing to it.
I hear someone ask, is ozone depletion causing more skin cancer? I don't know if we can really answer that. Or do you believe in the depletion of the ozone layer?
Well, there's places where there's holes in it, but as far as it contributing to it, the thought is yes, that's allowing more ultraviolet light through.
Yeah. So I guess you could walk around in the beekeeper suit.
Beekeeper suit is one alt. But then you have a problem with vitamin D deficiency. So,
well, you can take the supplement for that.
Okay.
You can drink milk while wearing a beekeeper suit.
You can.
You'll be fine.
It would work if it was honey, but
how about a beekeeper suit filled with milk? You just sort of slosh around.
You'd have to change it every day.
What's that sour smell?
I mean, do we even change our underwear every day?
Well, I would hope so.
We hope. I could talk about patient experiences with that. Let's not.
Oh, no, let's not, please.
Let's not. Oh, and that's just the ones who use underwear.
This one person says, I have bad eczema and tanning helps a lot. I only go maybe once a month. Is that safe?
Tanning would not be the way I'd want to do it. I don't like these tanning beds.
But you're talking about exposure to the sun.
Yeah, UV, I believe it's UVA is helpful. There's actually lamps you can get for it. PUVA lamps, PUVA. I don't know what the P is. Maybe it's some partial bandwidth of the light. But there's places in the world that are very good for example, psoriasis. Psoriasis is treated with sunlight exposure. And you want to get sunlight exposure with the least risk of damage of ionizing radiation of the ultraviolet light that damages. And there's places like the Dead Sea or what is it in California? Salt Sea, Death Valley.
Oh, Salton? Salton Sea.
These places where it's very low, below sea level. And the lower you go there, the more protection, the more atmosphere you get between you and the sun to protect against the bad bandwidths of light, but still let light through. And it's the light that's making it through is the light that helps with their symptoms of their psoriasis. So people actually go to the Dead Sea for the purpose of treating their skin disorder.
But the tanning bed, the indoor thing doesn't necessarily work.
Well, the tanning beds aren't necessarily the same wavelengths as a PUVA light that the dermatologist would use. And some people actually go to a dermatologist to do it's like a tanning bed, but the purpose isn't to tan. The purpose is to treat the skin problem. But they would get some tanning from it.
I've had this question pop up a couple times. Somebody wants to know how rare is ALS, and is it hereditary? We're talking about the famous Lou Gehrig disease.
Correct. I believe it is hereditary. Off the top of my head, I'd have to look it up to know for sure. And the incidence is low. In fact, if you guys want me to look it up, I can. And the place I look it up is my favorite library online. It's called Clinical Key, which I suppose anybody can get a membership to.
So now
if they don't mind paying hundreds of dollars a year.
Right. So in the meanwhile, I'll turn this around.
I'll answer anything.
Oh, yeah. So the doctor is actually looking something up for you. And this is the kind of service we provide here, or he provides here. So stand by while he looks up the data on ALS.
We can answer anything in the meantime.
Yeah, but in the meantime, if you want to drop a, hey, hi, Howie. Yeah.
Howie? Are they calling you Howie?
Okay. Well, okay, so interesting fact. Howie Mandel and I are exactly 1 day apart, or within one. We were born the same day, month, and year. You know, he on the 29th, I on the 30th. We could have been twins separated at birth.
Possibly.
I don't know.
So it looks like 10% or less of cases of ALS are the type that go through the family. The other 95% of cases of ALS are just not connected to a family history at all.
Okay. There you have it. So that's not something you should walk around worrying if it's going to be your day for ALS.
And as far as incidents, let's just say rare. I can't find.
Well, there's someone. I guess they're concerned about getting it. I don't know if it's like they have a reason to be afraid of getting ALS, or if they're just thinking it's.
Well, if there's somebody in their family who has it, they need to be talking to a genetic counselor.
Okay.
Absolutely. And then they can get testing to find out.
Okay, so let's say you get the testing, you find out that you are, in fact, susceptible. What does that do for you? Does that make you, worried about?
It's if the person wants to know. If they don't want to know, don't look it up.
Unless she clarifies, saying that no one in her family has it. So,
okay.
All
right.
I would say, our friend, find
something else to worry about.
Find something else to worry about. Seriously,
don't drive on the road.
Right.
Don't drive on Highway 49.
There are other things far more scary if you really must find something to worry about.
That's right. We have a 30-minute show, so we're going to go ahead and wrap up this week. Thank you so much for excellent questions. Periscope is so good as a source for questions.
And we'll be back same time next week.
10 o'clock Pacific time. And we'll put this out on the show so you can get it on iTunes probably by tomorrow. So until next time, this is Larry Finney.
Oh, wait. No. Here.
Hold
the camera.
Okay, there is Larry Finney.
This is Larry Finney. This is Larry Finney.
That is Larry Finney. Okay. Right. And this is Dr. Mark Vaughan telling you to stay